Hi, Tara at Wise Womanhood here. Today we're going to talk about the uterus again, and this is going to be part two. So if you haven't seen part one, I highly recommend it. Find it on my page. So we're going to go forward. We learned some about the anatomy of the uterus, and we're going to review just a bit to see why the uterus is vulnerable. Um, the uterus is held in place by this giant trampoline, is what I call it. It's a big ligament that's a little stretchy so that when the uterus grows during pregnancy, everything can still be happy and not stuck down into the pelvis where there wouldn't be room for the baby to grow. All right, this trampoline also tends to make the uterus vulnerable because when you are in any way jarred or disturbed, like for instance in a car accident or if you fall really heavily. So people who snowboard often have their uterus out of place. Women that are in gymnastics that do vaulting or do the parallel bars. A lot of athletic things can jar as well, even just jogging if you do it at the wrong time of your cycle. So, what happens when it goes out of place? Well, it can go sideways, um, and you can see that that would kind of impinge on the ovaries, which are kind of next to the egg tube comes through. So it could affect fertility, it could affect the ovaries. One of the common ways is that it can tip backwards. And this is kind of a picture of that. So what can happen, normally the uterus is just kind of near the bladder, a little bit behind it, a little bit above it. It can tip in different degrees, and you may have heard that you had a tipped uterus. Your doctor, when they did a pelvic exam, or your midwife may have mentioned this, and they often say, "Oh, don't worry, it's okay because a lot of women have that." Well, a lot of women also have menstrual cramps, have menstrual problems, fertility problems. So, once I show you why this is important, you'll know why you want to do some work with it. So, if it's the third degree and it's really tipped back, it actually can impinge on the rectum. When that happens, the uterus, because it is getting bigger as your menstrual cycle progresses, when it gets full at the end and it's heavier, it's going to lay back heavier on the rectum. And so often women may feel constipated at that time, right before their period, and then once they start bleeding and their uterus lightens up, then everything can come back out of their rectum. So that is a sign that your uterus is pushing back on the rectum. And it can also cause back aches because it's pressing up against the sacrum. So that's why you don't want your uterus to get out of place. So the vulnerable time is especially when you're going to have your period, because when the uterus is heavier, it's going to move more easily. So if you're jogging, your uterus is going to be going, and and if you're falling or you get knocked over somehow, you fall out of a tree, whatever way, something happens to your uterus. One friend I helped with her uterus, she was shoveling snow right before her period, and you twist like this, and her uterus had gone out of place, and she had cramps when she started that period, which she didn't usually have. So we did some massage, Maya abdominal therapy on her uterus, and we put it back in place. And the next time she did not have cramps again. So if you fix these things right away, they often can go back in place. If it lasts a long time, sometimes there are adhesions that kind of stick the uterus in the odd place, and it's a little more complex to deal with, but there are things we can do to help that. So that's one of the most common times is right before your period when your uterus can be heavier. So another time is postpartum, because the uterus is still somewhat bigger than usual, and the ligaments may be stretched, because when the uterus grew, the ligaments also grew and stretched. So the uterus can kind of flop around in there if you aren't careful. So one of the good things to do postpartum is to wrap the belly and hold the uterus gently in place until those ligaments can get back to a more stronger position and size as the postpartum has progressed. Okay, so those are two of the most common times when you are most vulnerable. So you want to watch for symptoms. What are the symptoms? Well, menstrual problems. They're very common. Also, cramping, brown blood that comes out with your period. So if your blood is kind of brownish at the beginning, that means there's some old blood that's coming out first as your uterus is releasing. If there's brown blood at the end, it means there's some really old blood that's kind of stuck in there, and it's coming at the end. So it's good that it comes out, but that's telling you that your uterus isn't draining properly with the cycle, and that can happen when it's not in the right place. Another thing is the fertility. And I had one client who her uterus was way to the side because her husband had a big one. Apparently, that's what she told me. So I didn't check it out. But anyway, so I had to help her get her uterus back in the middle. And then she conceived and had a normal pregnancy. So there are lots of ways to support the uterus in its positioning and its functioning, and that's one of the things I'm expert at. So contact me at wisewomanhood.com if you would like some help with your uterus, your cycles, your fertility, even your menopause, because that can be affected as well. So I hope to see you again soon. Keep watching. We're going to talk about menstrual cycle next time. All right. Bye-bye.